Hi, friends. If you find our cause worthy, then please donate a minimum of 25 rupees and share this video with your friends and family to spread the word.
Well, I'm a pediatrician working in Ranchi for past 30 years and above. And I'm also attached to one more hospital here, Santevita Hospital,
Mhm.
and one tertiary care hospital of pediatrics. This is known as Rani Hospital. It is one of the best hospitals of Eastern India. I have my own clinic, which is known as Manor Clinic. It is situated in Ranchi, location-wise, Kachari Chowk, Port Compound, Ranchi. For some time, I was also working in England in Manor Hospital in Birmingham. This is a small introduction. Yeah.
Thank you, Doctor. So actually, like we are from Kalpaka, a non-government organization, a charitable trust,
Yeah.
trying to help like rural India. But when we say like COVID, it's not only related to rural India. So it is related to everyone in India. So we want to get like more information from experts like you. So now, like when we say the third wave, initially like people were like we had some rumors like the third wave is only for kids, and kids are like more vulnerable to this disease. But later, then they told no, it can be for anyone. So usually, like the question what we'll have is, uh, as like elders are getting vaccinated, so there is like vaccinations are happening, and if elders are getting vaccinated, what about for kids? Like we know that there are some trials happening for 12 years and above, for kids age of like over 12 years and above. But what below the 12-year kids, or what in case like is there like how many vaccination for kids over 12 years? So can you please like help us with more information on this?
For children below 12 years, the studies are already been given up to the government by the different vaccine manufacturers. And most likely it may get approval by the end of this August maximum, August. And if it is done, it will be a great boon for kids protecting against COVID. And the vaccination will start by maybe after the approval from 12 year onwards. And parallelly, the studies from 2 years and above till 12 years is also going on parallelly at different hospitals. And it is an long study. If that goes well, most probably by the end of October, November, we may expect the vaccine for the kids above 2 years also. But the need of hour is to go for massive vaccination of all the adults right now so that they get protected against this dreadful virus, COVID, and they have an immunity to fight against that virus. And once it is done, they will be able to build up their own antibody, and they will pass on this benefit to their colleagues for not spreading to the other person. If somebody is infected and the person sitting next to him is also a person who is not vaccinated, then the chances of contracting the disease is more on the higher side. So that's why what I feel, the vaccination which is going on right now in the national level, that should go on in a very, very massive way. And people should come forward, and there should be no hitch regarding the vaccination, whether they should go for it or they should not go for it. If at all there is a question in their mind, they must clear it out by their treating doctor or their family doctor instead of speaking or taking opinion to their fellow colleagues. It's always better to speak to their family doctor. Family doctor is a person who is an actual family member of that family, and they will give you the honest advice. What I feel personally, that should go like this.
Okay. And before, in case like before this vaccination for kids, luckily, like in case like if there is no third wave, that's good. But in case if that starts before the vaccination, what are the precaution measurements that we need to take for kids, especially kids?
To avoid crowd, going to the crowds, and COVID appropriate behavior, like wearing a mask up till the nose level here, and washing their hands frequently, and to avoid any person whoever is suffering from cough and cold, irrespective of maybe some viral, whatever we never know. So it is always better to refrain from crowded place. We must go for our personal hygiene, and we must look for the latest guidelines by the government, what to follow and what not to follow. And that should be done very, very sincerely.
We have seen people now, like when we say like kids are in danger nowadays, like parents have started like locking the kids in their home itself. They're not ready to send them out. Nowadays, like there are no schools, so kids are always at home. And before this news of like kids getting infected, at least like kids used to play outside. They used to play outside, they used to mingle with other kids, they had some activities. But now, like when everybody says like kids are at danger, like I've seen like parents have started like locking their kids at home itself, so the physical activities have gone down. So what do you suggest, doctor? Like
Yes.
kids, like should they go out to play, or if they go out to play, like wearing mask is sufficient for them to play out?
Wearing mask is recommended above 5 years by the WHO. And regarding their outdoor activities, if it is an open area of their own society or nearby open park, that can be supervised by the presence of the parents. They should not be left alone. They should not be left alone. And right now, the vaccination drive is going on in a good pace, what we can see here. 37 crores plus vaccinations has already been done yesterday. It's a
Yes.
good pace. And probably if this goes well and the vaccines which are coming from the other sources also, that will boost the number of vaccinations in India, thereby giving more confidence to the parents also. This is my observation.
Yeah. And also, like one question, doctor. Before this COVID, like every year there used to be a few vaccinations, like the influenza, and there are some other vaccinations,
Yes.
especially for kids, that was like prescribed every year for kids. Will such vaccinations avoid COVID for some extent? Is it safe to get kids
Uh,
vaccinated with that?
Actually, this influenza vaccine has nothing to do with COVID, frankly speaking,
Okay.
because it is also a virus-induced cough and cold symptom. Influenza vaccine is more helpful for the flu virus, which is very common during the monsoon season from June to October. Previously, also, it is recommended by the pediatricians and other agencies to go for annual flu every year. It is recommended from 6 months age onwards till adults also they can go for the vaccine. Since the symptoms of flu, cough and cold and the COVID cough and cold look similar, it is quite confusing for the doctor also at the first point of meeting, whether it is a cough of COVID or it is cough from flu. So if a child is vaccinated against influenza vaccine, that is flu vaccine, at least that will be a boon for the child or the person to get protected from the flu virus cough and cold symptoms.
Okay.
And
Yeah.
if at all the COVID is there, doctors can easily identify regarding the further management of that cough and cold, whatever it is, as per their penetration.
Okay. Okay. So yeah, so that is like, as per your words, it is recommended to at least go with influenza so that like doctors can avoid the common
Yes,
cold and flu.
yes,
Okay, cool. Yeah, thanks for that information, doctor.
yes.
And I think like thank you so much for your time. Really, it helps for the public in case like if they really want to get to know like what can be done to avoid kids getting infected. Directly hearing from a pediatrician like you, so it's very honor to have you here. So, any few words, like a few words regarding Kalpaka, doctor, like what we are doing.
It is an excellent job, what I will say, to give a massive communication to the media, social media. And through that social media, it will spread through that agency to a lot of people who are still unaware of this. And that will definitely help to the society in return. And the fear of the third wave will automatically be on the lower side.
Yeah, yes, yes. Thank you so much, doctor. Thank you for your time.